Hello everyone and welcome to session 5 of module 7. In this session we are going to be looking at the different phases of evaluation. On slide 1 are session objectives. By the end of the presentation you'll be able to describe and discuss the 5 phases of the evaluation cycle. You will also be able to discuss the importance of measurement indicators, and we will review qualitative and quantitative methods that are appropriate for monitoring and evaluation. There are 5 phases to the evaluation cycle. The first is to plan the evaluation, following which you would select appropriate evaluation methods, and then you will collect and analyze information using the methods that you have chosen. Once you have analyzed that information, it's important to report your findings, and then from those findings, you have to implement any of the recommendations that are made in that report. Before beginning an evaluation, it's very useful to plan in advance. The first thing to do would be to determine what the purpose of the evaluation is, following which you would have to decide what type of evaluation is appropriate. Is it formative or summative? You would then decide on who is responsible for conducting the evaluation. What is the size of the evaluation team and what will each person do? In other words, their roles. You would also have to consider reviewing existing information in current program documents, including any information that has been collected through the monitoring process. You can then list all the relevant sources of information that make up your understanding of what is happening in the program, and then describe the program in more detail. Finally, you can assess the program's team's own strength and limitations to make sure that you account for any difficulties. Providing background information on the history and the current status of the program being evaluated includes the following: how the program works, in other words, its objectives, its strategies, and management process, and a number of issues related to the environment in which the program has been conducted, the policy environment, the economic and financial feasibility of the intervention, any institutional capacity that needs to be considered, whether there are socioeconomic or historical or cultural aspects that have to be brought into consideration, issues of partnership and ownership, any environmental factors and determinants, and if there is a reliance on technology in order to conduct the evaluation. Once you have planned for an evaluation, you also have to think about selecting appropriate evaluation methods. In this phase, it's important to identify the evaluation goals and objectives. Useful here is to use the SMART objectives, whether these goals are specific, measurable, achievable, realistic, and time-bound. You can then consider how you would formulate evaluation questions and sub-questions. This process can take quite a long time, as there might be a number of assumptions behind the questions you are asking. It's also very useful to pilot those questions to make sure that those assumptions come to the fore. You can then decide on the appropriate evaluation design and identify measurement standards and indicators that will help you to achieve what you're trying to find out at the end of the evaluation. It is very useful to continue with the planning by developing an evaluation schedule, so when things will take place and at what point in time, and to develop a budget in terms of how much it's going to cost to run this evaluation. An important part of this phase is identifying the measurement indicators. As a reminder, an indicator is a standardized objective measure that allows a comparison among different health facilities, or a comparison among countries, comparison between different time periods, or a measurement of the progress towards achieving program goals. So there can be many different types of indicators depending on what you're trying to achieve. Some characteristics have to be considered when choosing different indicators. The clarity of the indicator is important, so they should be easily understandable by everybody on the evaluation team and for those who will be reading the outcomes of that evaluation. They have to be useful, so they should represent all the important dimensions of performance, and they have to be appropriately measurable. Here you can consider different forms, whether it's quantitative or qualitative. Are the indicators reliable and valid? So can they be collected consistently by different data collectors? And does it measure what you mean to measure? Here is an example of a formative assessment process. If you are trying to find out about staff supply, you might have to ask the question, is staff supply sufficient? In order to answer this question, what indicators could you use? You could look, for example, at the staff to client ratios. Or if we're thinking about service utilization, you can ask a question, what are the program's usage levels? In order to understand this, you would have to measure the percentage of utilization. Similarly, at the end, you can see client satisfaction. The simple question is, how satisfied are clients or patients? In order to measure this, you'd have to think about the percentage of clients who report being satisfied with the service received. Here I have some examples from a summative assessment process. Here we're trying to understand what the outcome is at the end of a project. For example, we might want to be measuring things like changes in behavior or morbidity and mortality. For changes in behavior, we'd ask a question such as, have risk factors for cardiac disease changed? In order to identify this, we would use this measurable indicator. We would want to compare proportions of respondents who reported increased physical activity. Similarly, with morbidity or mortality, what we would want to ask is, here's an example, has lung cancer mortality decreased by 10%, if this is a goal that was set in a project? In order to do this, we would have to look at the indicator for age-standardized lung cancer mortality rates for males and females. The third phase of the evaluation cycle is to collect and analyze information. Once you have determined what your data collection method is and the design of that process, and you have planned appropriately, what is important to do is to develop your data collection instruments. This will be familiar to you from your research process. The tool that you use to collect information will determine what you're trying to report on. Very useful here is to pre-test that tool to see if there are any glitches. Then you can undertake to actually collect the information itself, and that process might take quite a long time, so you have to plan for that. Once you have collected the information, it has to be put into a format that is analyzable and so it can be interpreted. And you have to actually plan into your evaluation how you're going to analyze that data and what you're going to do with the findings. Useful here is to use a program logic model, which provides a framework for an evaluation. This is a flow chart that shows the program's components and the relationships between components and the sequencing of events. This will be familiar to you from some of the models that we have seen on this course. So what are the inputs that need to be considered? What are the outputs? And what is the intended goal or outcomes? So we might want to consider the who or the what. So what was being invested? So for example, the number of staff or volunteers, how much time, how much money, what equipment is needed. The outputs are the activities themselves, so what was done, or the targets, the groups that are targeted, such as whether there were workshops that were run, any meetings that took place in order to achieve this, any training that had to happen in order to collect the information, and then who was targeted. So who were the participants or the clients or the people involved in the data collection process. And when we look at the outcomes, we want to see what came out of this. So this is the learning and action areas. So what knowledge or attitudes or skills or motivations were needed and what was produced at the end of the evaluation. So there are different processes that we can use to collect information, and we know that we can either use quantitative or qualitative designs. So there are 5 frequently used qualitative data collection processes that are used in evaluation. The first is unobtrusive seeing. This is involving an observer who is not seen by those who are being observed. The second is participant observation, where we are involved as an observer who does not take part in the activity but is seen by the activity's participants. Interviewing is a very common process for qualitative data collection, where it's involving a more active role for the evaluator, because the person poses questions to the respondents, usually on a one-on-one basis, but it could be done in a group setting. So here we could have, for example, a form of group-based data collection processes such as focus groups. And finally, we would look at content analysis. So what is coming out of this qualitative data? So which involves reviewing documents that exist and any transcripts to identify patterns within the materials that emerge from the evaluation questions. The other method of gathering information is to use quantitative data collection tools. Quantitative or numeric information is obtained from various databases and can be expressed using statistics, which is very useful for showing change or change indicators. Some tools that can be used are surveys or questionnaires, registries, activity logs from programs, administrative records or patient-client charts, registration forms, if there are any existing case studies from the program, or attendance sheets. Before using a tool, it's also useful to pre-test and pilot that tool. There are a number of things that need to be considered with piloting a test. So, testing the instrument is useful. So you can look at what questions are being asked and how they are grouped and laid out, what is the order of the questions and whether things should be changed around. Testing the way that instruments are administered, so whether a questionnaire is appropriate or whether you're going to run that questionnaire via a phone interview, so on and so forth. Testing the way that responses are recorded, if you're using a tally sheet or any computer assistant telephone interview format. And finally, testing supportive documents or procedures. So whether the cover letters are clear, whether consent forms cover all the information that is required. The fourth phase is to report the findings once you have collected and analyzed the information. In this phase, it's important to write an evaluation report, and you therefore can then decide on the method of sharing the evaluation results and on the communication strategy that is most appropriate. You would have to consider sharing the drafted report with stakeholders so that it might be revised as needed and so that it can be followed up if there are any outstanding or contentious issues. Once you have finalized your report, you will then have to think about how you are going to disseminate the evaluation report and the findings so that it is most useful and usable. And the final phase is to implement any of the evaluation recommendations. In this phase, it's important to develop a new or revised implementation plan in partnership with any stakeholders who have been involved in the process. You can also consider the monitoring of the implementation and evaluation recommendations and reporting regularly on any of the progress that is made through the implementation of these recommendations. And therefore, it's also useful to plan for any further evaluations that might need to take place, considering the results that have come out of your report. On this final slide, we can see an example of monitoring and evaluation of a health systems reform for health system strengthening. Down the left, you can see the different phases in terms of planning for the evaluation, what indicators are being used, how the information is collected, how it is analyzed and synthesized, and finally how it is communicated and used in the evaluation process. Across the top, you can see that a logic model has also been applied for the process of the evaluation. You can see the inputs or processes that need to be considered. So for the indicators, there were a number of issues that were raised. So how much will this evaluation cost? How is it going to be managed? And what aspects are going to be evaluated? Here you can see they were looking at infrastructure, the workforce, supply chain, and different forms of information. For the data collection phase, they had to consider different administrative sources of information. And you can see as you move through the evaluation, there are outputs to consider from the logic model, the outcomes, and finally the impact. What was the outcome of this program and how was it evaluated?